Hello and welcome. My name is Stephen Perlin, and I am here today at UHS Binghamton General Hospital in the GI lab because March is Colorectal Cancer Awareness Month. Now, this is one of the most preventable cancers and also one of the most common. So it's very important what we're here talking about because really what you need to do is get screened. And now we know there's a lot of hesitancy when it comes to colonoscopies and coming in about this type of stuff, but we're here to kind of assure you that everything's all right, it's going to be okay, and you got to get in here because this is something that's very preventable, and we don't want you to have to go through something awful, obviously, which we're talking about colorectal cancer. Today with me is Vice President of Digestive Services and Academic Affairs, Dr. Amin Hila. Thank you for joining me. Really appreciate it.
Thank you for having me today, and thank you for joining us online.
Absolutely. And Dr. Amin Hila, you're going to talk to us about why it's so important to get screened, why people should be coming in to do this, and obviously no better time to talk about it now in March.
Absolutely. So colon cancer, as you mentioned, is actually preventable in most cases because if we find it at very early stages or at even better pre-cancer stages, then we can actually completely prevent the disease from developing. So for most people, almost everybody that would develop cancer, it usually starts as a polyp. And if we find a polyp during a colonoscopy, we remove it, we 100% prevent that specific cancer from developing. And so that is why it's very important to undergo these screening tests, because then you can completely prevent the disease in 99% of cases.
Now, when it comes to screening, is it something that you should be feeling like, oh my God, this is bothering me, I should get in, or just something that you should do by a certain age to be safe?
Absolutely. Great question. Unfortunately, colon cancer has no signs and no symptoms until it's almost too late. And so this is definitely a screening test and not a diagnostic test, meaning it is meant for people who have no symptoms. I mean, obviously, we do colonoscopies for other reasons for people who have symptoms, but specifically to prevent colon cancer for screening purposes, it's for people who have no symptoms. Traditionally, it used to be at age 50 for people at average risk, but recently, about a couple of years ago, this was changed to age 45. And that is because we have noticed that the data has shown us, we, the medical community, that colon cancer actually can be even better prevented if you start earlier looking for it and doing these procedures. And so that is why it's very important to follow up with your primary care doctor that would refer you for these tests when appropriate. People who have a strong family history of colon cancer or certain other diseases such as ulcerative colitis actually would need to have these tests at younger ages.
You stole the words right out of my mouth, Dr. Hila. I was going to ask you if you have some sort of family history, should you be getting in a little bit sooner than the age 45? And it sounds like you already answered my question. Yes, you should be.
And it depends on what that family history is. And for example, if you have a parent who had colon cancer at age 42, then you should have your first colonoscopy at age 32, 10 years younger. And so that's why, and there's all these rules that we have to follow depending on the risks and the family history.
Oh, that's a very important point. And I mean, I think one of the scariest things you mentioned is that there are no real symptoms. So that makes it, I think, doubly important, triply important, however you want to put it, extra important because there's going to be no signs that this is coming and this could affect you.
Exactly. And, you know, again, I want to stress the fact that the intention here is to prevent cancer, not to find cancer. And that's the whole idea. This is very different from other potentially screening tests that look specifically for cancer. This does look for cancer, but actually we want to find before cancer stages. Well, as I mentioned earlier, polyps.
Yeah.
And that's the goal, and that's why colonoscopy is actually the gold standard, as opposed to other tests that may be available. You can see on TV and online, there's advertising, for example, for a test called Cologuard, which basically takes a stool sample and looks for colon cancer. It's a great test to find colon cancer. It's about 95% accurate, while colonoscopy is 99% accurate. But it's still very good for that. But for finding polyps, it actually is not that good. It's only 50% accurate. It's like a coin toss. And so while colonoscopy is 95% accurate at finding polyps.
Yeah, and that's a big
so you
difference.
can see the difference. And that's why your doctor is probably pushing you to have a colonoscopy rather than a Cologuard test. However, if there's a reason that you can't have a colonoscopy or you absolutely don't want to have one, at a minimum get some other tests such as Cologuard.
And that's one of the reasons also we're here, as your provider is pushing you to get this colonoscopy, you might be resisting a little bit, or you might be hesitant. And we're trying to make you understand that the importance, obviously, and what you're going to be going through. So we have some of the equipment here that we will use, that Dr. Healy will show and kind of talk to us about. So Dr. Healy, if you want to take it away, because I know I don't know much about this equipment.
And before I get into this, let me talk a little bit about what's out there in the general public's perception about colonoscopies.
Great.
The thing that people worry most about is actually not the procedure. It's actually drinking the prep the night before the procedure. Traditionally, up until a few years ago, the prep used to be about a gallon of pretty nasty tasting liquid that people have to drink. It is still used in some cases, but the majority of people now can have a much, much more tolerable medication that is only 2 small glasses. And you would drink 1 glass of that, it's about this big, and then 2 glasses of water, and then a few hours later, another glass of that and two glasses of water. So it is not as bad as it used to be by a large margin.
Yeah, it sounds a lot easier.
Occasionally, your doctor will still insist on the large gallon for health reasons and history and things like that. But 90% of the time nowadays, we're using a much more tolerable medication, a much better tolerated medication.
That's probably exciting for a lot of people to hear.
Oh, absolutely. It's a huge. If people have tried both, they'll tell you they really prefer. I mean, I'm not going to say they love the second one. You know, I mean, it's not necessarily something you really want to do for fun, but
there's a clear preference.
There's a huge difference in how well tolerated it is. The procedure itself, most of the time, and the reason I say most of the time, occasionally a patient will be awake for the procedure per their request. Sometimes people don't want to get sedation medication because they want to go back to work the same day or something. But that's rare. 99% of the time, people are sedated for the procedure. So we give them IV medication. That's why we have that big machine up there that is stocked with medications for the patient. That's where they are. And then we put an IV in, we give them medication, they fall asleep, and while they're asleep, we do the procedure. And so it's very comfortable for the patient. They don't feel anything. In fact, most of the time they wake up and they're in the recovery room, and they say, "Oh, when are we going to do the procedure?" And we're like, "It's already done." You know.
Oh, wow,
and so they get a nice sleep during it. During the procedure per se, this is the instrument we use. This is called a colonoscope. It's basically a long tube to allow us to go inside, and it has light and a camera. And if you look at this screen here, you can see my finger passing in front of it, and that basically is what we use to look inside somebody. I just turned on the lights, so you can see my fingers in there. Obviously, it's magnified. And through this instrument, we have a channel that allows us to push instruments through it and remove polyps or whatever we need to do, take biopsies, et cetera, do treatment sometimes with it.
Okay.
So this is the machine that we use. Obviously, it is sterilized in between patients, and we have machines that take care of it and everything like that.
And how long does this usually take, the procedure and everything?
Somewhere between coming into the room and leaving the room, the endoscopy room, I would say half an hour in total.
Well, that's not bad at all. So you get a good nap and you get to check on your health. That seems like a win-win situation to me.
Absolutely. Most people are in and out of the GI lab within 3 hours, you know, between coming in, doing some paperwork, getting their IV, having the procedure done, sleeping for half an hour outside, waking up, you know, and going home.
And potentially getting a clean bill of health, or at least getting to start the fight against cancer early, which
Absolutely.
I think is probably one of the best things you can get.
Again, prevention. I have to tell you, I mean, I started here at UHS doing this in 2006. I used to diagnose a lot of cancer in those days because colon screening had just started a few years earlier. And now I rarely see a patient with cancer because we're preventing it. We're catching it earlier and earlier and earlier and preventing it by removing these polyps.
That's great. And Dr. Healy, is there anything else you want to add to make sure that our audience knows today?
No, I would encourage everybody to think about this. It really is a life-saving. And, you know, as we mentioned earlier, not because you're feeling fine doesn't mean that there's nothing growing inside you. In fact, by the time you see some blood or you have some pain or you have some problem, generally by then there's a big cancer, potentially with metastasis that, you know, could be deadly at that point. So please don't forget about this. 45 years old now, so it is a change. Mm-hmm. Most insurance companies are paying for it, and all will be soon, you know, covering it at age 45. So.
All right. Well, I shouldn't have to say this to wrap it up, but I'm going to say it anyway. Get screened and be smart about it, obviously. We were talking a lot about this today. I think I'm hoping we're opening a lot of eyes. It's important, and especially during the month of March, there's no better time to start worrying or start thinking about getting screened. So thank you very much for everybody who joined us out there. For more information, you can always head to nyuhs.org to learn more and obviously to start scheduling your appointment. And everybody stay safe out there. Thank you once again for joining us.